If you think about the modern human lifestyle, one of the most dramatic changes over the last century is how much time we spend sitting. We sit while working, sitting while driving, sitting while eating, and then sitting again while relaxing. And what's important to understand is that prolonged sitting isn't just the absence of exercise. It triggers its own unique set of biological responses in the body, many of which actively harm metabolic, cardiovascular, and brain health. From a physiological perspective, the human body was designed for frequent movement. Our muscles, especially the large postural muscles in the legs and glutes, act like metabolic engines. When they contract regularly, they help regulate blood sugar, clear triglycerides from the bloodstream, and stimulate beneficial signaling molecules called myokines. And when we sit for long periods, these muscles become electrically silent, and that silence has consequences. One of the earliest systems affected by prolonged sitting is glucose metabolism. Studies show that sitting for extended periods reduces the activity of GLUT4 transporters in skeletal muscle. These transporters are responsible for pulling glucose out of the bloodstream and into muscle cells. So when they're inactive, blood sugar stays elevated for longer periods of time, even in people who exercise regularly. This means that you can go to the gym for an hour, but still experience impaired glucose control if you sit for most of the remaining day. Another major issue is insulin resistance. When muscles aren't contracting, they become less responsive to insulin, and over time, the pancreas has to release more and more insulin to achieve the same effect. Chronically elevated insulin is not only a risk factor for type 2 diabetes, but it also promotes fat storage, particularly visceral fat around the organs. This type of fat is metabolically active and releases inflammatory molecules that further worsen insulin resistance, creating a vicious cycle. Prolonged sitting also has a significant impact on lipid metabolism. Normally, muscle contractions activate an enzyme called lipoprotein lipase. This enzyme breaks down triglycerides in the blood so they can be used for energy or stored safely. When you sit for long periods, lipoprotein lipase activity drops dramatically. As a result, triglyceride levels increase and HDL cholesterol, often referred to as good cholesterol, decreases. This shift increases the risk of atherosclerosis and cardiovascular disease. Blood flow is another critical factor. Sitting for extended periods slows circulation, particularly in the lower body. Reduced blood flow means less oxygen and fewer nutrients are delivered to tissues, while waste products are removed more slowly. Over time, this can impair endothelial function, which is the ability of blood vessels to dilate and constrict properly. Endothelial dysfunction is an early marker of cardiovascular disease and is strongly associated with hypertension and heart attacks. What's particularly concerning is that these effects occur independently of traditional exercise. Multiple studies have shown that even people who meet the recommended guidelines for physical activity still face increased health risks if they sit for long, uninterrupted periods. This suggests that sitting is not simply the opposite of exercise, but a distinct behavioral risk factor with its own biological mechanisms. From an evolutionary standpoint, this makes sense. Humans evolved in environments that required constant low-level movement throughout the day. Walking, squatting, carrying, and standing were normal parts of daily life. Long periods of complete muscular inactivity were rare. Our biology has not adapted to the modern reality of sitting for 8, 10, or even 12 hours a day. So when we talk about the health risks of sitting too much, we're not just talking about stiffness or back pain. We're talking about deep systemic changes that affect how our cells handle energy, how our blood vessels function, and how inflammation is regulated throughout the body. Understanding these mechanisms is the first step toward recognizing why reducing sitting time is just as important as exercising, and in some cases, maybe even more critical for long-term health. Beyond metabolism and cardiovascular health, prolonged sitting has profound effects on inflammation and immune function. And this is an area that often gets overlooked when the body remains inactive for long stretches of time. It shifts toward a more pro-inflammatory state. This low-grade Chronic inflammation doesn't cause immediate symptoms, but over years, it contributes to many of the diseases we associate with aging, including heart disease, neurodegeneration, and certain cancers. One reason this happens is because movement itself is anti-inflammatory. And when muscles contract, they release signaling molecules known as myokines. Some of these myokines, such as IL-6, when released from muscle during movement, actually reduce inflammation by inhibiting pro-inflammatory cytokines like TNF-alpha. But when you sit for hours, you lose this protective signaling. The immune system subtly shifts toward a state that favors inflammation rather than resolution. Prolonged sitting also alters how fat tissue behaves. Inactive muscles lead to reduced energy demand, and excess calories are more likely to be stored as fat. Over time, this increases visceral fat accumulation. Visceral fat is not just passive storage. It actively secretes inflammatory molecules, including cytokines and adipokines, that interfere with insulin signaling and immune regulation. This creates a feedback loop where inactivity promotes fat gain promotes inflammation, and inflammation further impairs metabolic health. The immune system is also affected by reduced circulation. Movement helps circulate immune cells throughout the body, allowing them to perform surveillance and repair. Sitting for long periods slows the circulation, particularly in the lower extremities. This reduced immune trafficking can impair the body's ability to respond efficiently to infections and tissue damage. Over time, this may partially explain why sedentary behavior is associated with higher rates of chronic illness. Another critical system influenced by excessive sitting is the musculoskeletal system. Bones, like muscles, respond to mechanical stress. Weight-bearing movement stimulates osteoblast activity, which helps maintain bone density. When sitting becomes the dominant posture, bones receive fewer mechanical signals, leading to gradual bone loss. This is especially concerning for older adults, as it increases the risk of osteoporosis and fractures. Muscle tissue itself also undergoes changes. Prolonged inactivity leads to muscle atrophy, particularly in the legs and core. This loss of muscle mass doesn't just affect strength and mobility, it also reduces metabolic capacity. Muscle is one of the primary sites for glucose disposal, so losing muscle further worsens blood sugar control. Additionally, reduced muscle mass is associated with higher mortality risk independent of body weight. There's also a neurological component to prolonged sitting. Reduced physical activity affects brain-derived neurotrophic factor, or BDNF, a protein critical for learning, memory, and overall brain health. Movement increases BDNF production while inactivity reduces it. Over time, lower BDNF levels are associated with cognitive decline, mood disorders, and increased risk of neurodegenerative diseases. What's striking is how quickly some of these negative effects begin. Research shows that insulin sensitivity and lipid metabolism can worsen within just a few days of increased sitting time. And this means the body responds rapidly to inactivity, and the damage doesn't require years to begin accumulating. The good news is that this also means the body can respond quickly to positive changes. And it's also important to recognize that sitting tends to cluster with other behaviors that compound risk. Long sitting periods often coincide with screen exposure, reduced sleep quality, and mindless eating. These factors together amplify inflammation, disrupt circadian rhythms, and further impair metabolic health. So sitting too much isn't just a posture problem or a productivity issue. It's a biological signal to the body that energy demand is low, repair processes can slow down, and inflammatory pathways can remain active. Over time, this internal environment sets the stage for chronic disease. In the next part, we'll explore how prolonged sitting affects the brain, hormones, and long-term disease risk, and why breaking up sitting time may be one of the most powerful health interventions available. So when we look at the long-term health consequences of excessive sitting, one of the most compelling areas of research is its effect on the brain and hormonal regulation. The brain is incredibly sensitive to changes in blood flow, nutrient delivery, and inflammatory signaling. all of which are influenced by how much we move throughout the day. Prolonged sitting quietly disrupts these systems, often without any immediate warning signs. And one of the key mechanisms is cerebral blood flow. Movement increases heart rate slightly and improves vascular function, which helps deliver oxygen and glucose to the brain. Sitting for long periods reduces this dynamic circulation. Over time, reduced cerebral blood flow is associated with declines in attention, memory, and processing speed. Some studies have found that people who sit for many hours a day show structural changes in brain regions involved in memory, including reduced thickness in the medial temporal lobe. Hormonal balance is also affected by chronic inactivity. Prolonged sitting alters the regulation of hormones involved in appetite, stress, and energy balance. For example, inactivity can disrupt leptin and ghrelin signaling, the hormones that regulate hunger and satiety. This makes it easier to overeat, even when the body doesn't actually need more energy. Over time, this hormonal dysregulation contributes to weight gain and metabolic dysfunction. Cortisol, the primary stress hormone, is another important factor. While acute stress responses are normal and even beneficial, chronically elevated cortisol can be harmful. Sedentary behavior has been associated with higher baselines. Cortisol levels, particularly when combined with screen exposure and mental stress, elevated cortisol promotes muscle breakdown, increases blood sugar, and encourages fat storage around the abdomen, further increasing disease risk. Prolonged sitting also affects mitochondrial function. Mitochondria are the energy-producing structures inside our cells, and they respond strongly to physical activity. Movement stimulates mitochondrial biogenesis, improving the number and efficiency of mitochondria. When activity levels are low, mitochondrial turnover slows, leading to reduced energy production and increased oxidative stress. This decline in mitochondrial health is a central feature of aging and many chronic diseases. Over years and decades, these changes translate into a significantly higher risk of major diseases, and large population studies consistently show that higher daily sitting time is associated with increased risk of cardiovascular disease, type 2 diabetes, certain cancers, and all-cause mortality. What's particularly important is that these associations remain even after adjusting for exercise, body weight, and smoking. This reinforces the idea that sitting itself is a distinct risk factor. Cancer risk is an area of growing concern. Sedentary behavior has been linked to increased risk of colon, breast, and endometrial cancers. Several mechanisms may explain this, including increased insulin and insulin-like growth factor, signaling, chronic inflammation, and altered sex hormone metabolism. Sitting for long periods may also slow gastrointestinal transit time, increasing exposure of the colon to potentially harmful compounds. There's also an impact on vascular aging. Blood vessels adapt to regular movement by becoming more elastic and responsive. When movement is absent, arteries stiffen more quickly. Arterial stiffness increases blood pressure and places additional strain on the heart. This process accelerates biological aging and raises the risk of stroke and heart failure. What makes this issue especially challenging is that sitting is often perceived as harmless or even necessary. Many people equate physical inactivity only with a lack of structured exercise, not with prolonged sitting. But biologically, the body responds to hours of uninterrupted sitting as a signal to downregulate repair, reduce energy expenditure, and tolerate higher levels of inflammation. The encouraging aspect is that the body is highly adaptable. Research shows that simply breaking up sitting time with brief bouts of movement can significantly improve metabolic and vascular markers. Standing, light walking, or even gentle muscle contractions can restore some of the signaling pathways that are suppressed during prolonged sitting. Understanding the brain, hormonal, and disease-related consequences of excessive sitting reframes movement as a fundamental biological requirement, not just a lifestyle choice. In the next part, we'll dive into how sitting affects aging, longevity, and why small, frequent movements throughout the day may matter more than intense workouts done only a few times a week. When we talk about aging and longevity, one of the most important concepts is cumulative exposure. It's not just what you do occasionally, but what your body experiences day after day, year after year. Prolonged sitting accelerates several biological processes that are tightly linked to aging, and this happens in ways that are often invisible until significant damage has already occurred. One of the central hallmarks of aging affected by excessive sitting is chronic inflammation, sometimes referred to as inflammaging. As movement decreases, inflammatory signaling remains elevated. While anti-inflammatory pathways are understimulated, this persistent low-grade inflammation damages tissues over time, impairing cellular repair and increasing susceptibility to age-related diseases. Inflammation also interferes with autophagy, the cellular recycling process that helps remove damaged proteins and organelles. Autophagy is strongly stimulated by metabolic stressors such as exercise and fasting. When sitting dominates the day, metabolic demand remains low and autophagic activity decreases. This allows cellular damage to accumulate, contributing to dysfunction in organs like the liver, brain, and cardiovascular system. Reduced autophagy is linked to accelerated aging and shorter lifespan in multiple animal models. Telomere health is another area influenced by physical activity patterns. Telomeres are protective caps at the ends of chromosomes that shorten with each cell division. Excessive sitting has been associated with shorter telomere length, likely due to increased oxidative stress and inflammation. Shorter telomeres are linked to higher risk of chronic disease and reduced lifespan. Regular movement, even at low intensity, appears to help preserve telomere length by reducing oxidative damage. Sitting too much also affects circadian biology. Human physiology follows a roughly 24-hour rhythm that regulates hormone release, metabolism, and sleep. Movement during the day helps reinforce these rhythms. When physical activity is minimal and prolonged sitting dominates, circadian signals become weaker. This can lead to impaired sleep quality, altered glucose metabolism, and increased evening cortisol levels. Poor sleep then feeds back into reduced daytime activity, creating a self-reinforcing cycle. From a functional aging perspective, prolonged sitting accelerates loss of mobility and independence. Muscle strength, balance, and joint flexibility all decline with inactivity. This increases the risk of falls, fractures, and disability later in life. Importantly, these changes don't only occur in old age. Middle-aged adults who sit for long periods already show measurable declines in muscle quality and functional capacity. Longevity research consistently shows that populations with the longest lifespans incorporate frequent, low-intensity movement throughout the day. They walk, stand, squat, and perform daily tasks that keep muscles active. These movements may not look like formal exercise, but biologically they provide constant metabolic stimulation that protects against disease. In contrast, modern sedentary lifestyles concentrate movement into short exercise sessions, followed by long periods of inactivity. What's particularly striking is that small changes can have disproportionate benefits. Studies show that interrupting sitting every 30 to 60 minutes with just a few minutes of movement can improve insulin sensitivity, lower blood pressure, and reduce inflammatory markers. These benefits accumulate over time and may significantly slow biological aging. There's also an interaction between sitting and diet. When sitting dominates, the body's ability to handle nutrients is impaired. Glucose and lipids remain elevated in the bloodstream for longer after meals, increasing oxidative stress. This means that the same meal can have very different metabolic effects depending on how active you are throughout the day. Light movement after eating can dramatically improve post-meal blood sugar and lipid responses. Understanding sitting as an aging accelerator reframes how we think about daily habits. Longevity isn't built only in the gym or during intense workouts. It's built in the small, repeated decisions to stand up, move, and engage muscles throughout the day. In the final part, we'll focus on practical, evidence-based strategies to reduce sitting time and restore healthy movement patterns without requiring drastic lifestyle changes. The most empowering aspect of the science around sitting is that the solutions are surprisingly simple and highly effective. You don't need extreme workouts or dramatic lifestyle overhauls to counteract the damage caused by prolonged sitting. What matters most is frequency of movement, not intensity. From a biological standpoint, the body responds strongly to small, repeated signals that muscles are active and energy is being used. One of the most effective strategies is breaking up sitting time regularly. Research shows that standing or moving for just 2 to 5 minutes every 30 to 60 minutes can significantly improve blood sugar control, lipid metabolism, and vascular function. These brief interruptions reactivate muscle contractions, restore blood flow, and re-engage beneficial signaling pathways that are suppressed during sitting. Standing desks can be helpful, but standing alone is not enough. Prolonged standing without movement can also lead to discomfort and circulation issues. The goal is dynamic movement, shifting weight, walking, stretching, or performing light bodyweight movements keeps muscles engaged. Even subtle activities like calf raises or gentle squats can stimulate muscle metabolism and improve circulation. Walking is one of the most powerful tools available because it's accessible and sustainable. Short walking breaks throughout the day are particularly effective. A 5 to 10-minute walk after meals can dramatically reduce post-meal blood sugar spikes and improve insulin sensitivity. This simple habit has profound implications for long-term metabolic health. Incorporating movement into daily routines is another key strategy. Taking phone calls while walking, using stairs instead of elevators, parking farther away, or doing brief mobility exercises during breaks all add up. These actions may seem insignificant individually, but biologically they provide continuous metabolic input that protects against disease. Strength training also plays an important role. Building and maintaining muscle mass increases the body's capacity to handle glucose and fats. While strength training sessions are valuable, they work best when combined with reduced sitting time. Throughout the day, muscle that is trained but then left inactive for hours still loses many of its metabolic benefits. Another powerful tool is awareness. Many people underestimate how much they sit tracking sitting time or setting reminders to move can dramatically change behavior. Simple cues such as alarms or app notifications can prompt movement until it becomes habitual. Over time, these interruptions become automatic, requiring little conscious effort. Environment design matters as well. Creating spaces that encourage movement makes healthy behavior easier. Keeping frequently used items farther away, using adjustable desks, or arranging workspaces to require standing and walking can reduce unconscious sitting. And the environment often shapes behavior more effectively than motivation alone. Sleep and recovery also interact with movement. Better sleep improves energy levels and makes movement throughout the day easier. In turn, frequent movement improves sleep quality by supporting circadian rhythms and reducing stress hormones. And this positive feedback loop amplifies the benefits of reducing sitting time. Ultimately, the goal is to shift from a sedentary mindset to a movement-rich lifestyle. This doesn't mean exercising constantly. It means restoring the natural pattern of human activity. Frequent, low-level movement spread throughout the day. When you do this, you support metabolic health, protect the brain, reduce inflammation, and slow the biological aging process. Sitting too much is not a personal failure, it's a byproduct of modern environments, but the body remains remarkably responsive. Each time you stand up, take a few steps, or engage your muscles, you send a powerful signal that supports health and longevity. Over time, these small actions accumulate, transforming risk into resilience and creating a foundation for long-term well-being.